Let's face it, the older we get, the harder it is to lose weight. If you're plagued by stubborn pockets of fat that diet and exercise just won't address, you're not alone. And more importantly, your quest to rid yourself of the bulge isn't hopeless. You can reshape your body to fit into those skinny jeans and regain your confidence through lipoplasty. Commonly referred to as liposuction, this surgical procedure can help you get the slimmer look you long for. Before moving forward with any type of liposuction, there are some basic guidelines you should keep in mind in order to decide if the procedure is right for you. And as with any major decision, you should weigh the pros and cons, make sure you're well educated and informed, and do everything possible to minimize the risks. The first and most important step is choosing the right doctor. While any doctor can call themselves board certified, a true specialist is one who is actually board certified in plastic surgery. Put your mind at ease by checking your doctor's training, credentials, license, and board certification. Next, you need to determine if you're a good candidate for the procedure. The ideal candidate has good skin elasticity and limited amounts of fat in order for the procedure to be successful. In addition to the physical criteria, it's important to have realistic expectations and be willing to follow the doctor's pre- and post-surgery plan to a T. This should be determined during your consultation, and you should be prepared to have an open and honest conversation with your doctor. The more you're able to clearly express your expectations, the easier it will be for your doctor to exceed them. There are several different techniques used in administering liposuction, but not everyone is a good candidate for this procedure. This video will educate you on the liposuction procedure options your doctor might discuss with you. The most common and basic technique is suction-assisted liposuction, which involves the insertion of a thin hollow tube through which suction is applied to remove fat. Those with localized fat deposits and good skin tone are good candidates for this procedure. Power-assisted liposuction uses special equipment that allows for back and forth movement to dislodge fat. This technique uses less force, which may lead to a decrease in tissue damage. If it's your love handles that bother you, then ultrasound-assisted liposuction may be the right option for you. This procedure makes use of high-powered radiofrequency energy to help rupture or dislodge fat cells prior to removing them using the suction-assisted technique. Laser-assisted liposuction involves the use of low-energy lasers to break up the fat cells prior to removal. As an added bonus, the heat emitted by the laser used in this procedure also creates collagen, which can minimally tighten loose skin. There are many more body-shaping procedures available and new ones being introduced constantly, so it's important to do your research and educate yourself on some of the latest options available. A comprehensive exam and personalized consultation with your doctor will determine what's needed to achieve the best possible results for you. You'll find that the more you share with your doctor, the more likely you are to be pleased with the final results. So make sure you clearly communicate what you want, and more importantly, what you don't want. Anticipating your results is the fun part, but it's important to understand potential complications, alternative options, recovery time, and modifications you may need to make to your daily schedule should you decide to move forward with the procedure. Don't forget to ask these questions during your consultation, and don't be afraid to ask about additional fees or payment plans. Once all of your options are discussed and your questions are answered, it's time to book your appointment.